Hello, and welcome to the Flipside. I am your host, Dr. Michael Nichols. I think we have an exciting show for you today. This past week that just went by, I'm recording this on a Sunday. It'll be put out tomorrow on a Monday. And this past week was a nerve-wracking week for me and for I know many of my fellow Americans who have been watching very closely the confirmations of, actually several of Trump's nominees are going through confirmation, went through confirmation last week. But of course, the one for me that is so important and it's so near and dear to my heart is the confirmation of RFK Jr. This is, in my humble opinion, one of the most important confirmations, one of the most important events in American history, recent history at least. And I have a friend who who said, "Michael, you're way too invested in this situation." And, I looked at him and I said, "You are right. I am very invested in this." And, I would even probably agree, maybe I'm a little too invested in it, but I'm invested in this situation because, number one, I have spent my entire adult life in the field of health in a variety of different positions, but in the field of health. Health as a topic is and has been the center point of my existence for as long as I can remember. So that's number one. Number two, I've been involved in this health freedom movement, which is the movement behind getting mandates taken away from vaccines. For far too long, we have been mandated to get vaccinations. And this shouldn't be a mandate. This should be a personal choice to decide whether or not vaccines or any other medication or any other potentially harmful substances injected into you or your child especially, it should be a personal choice, period. And that has been a mission of mine for many decades. In that mission and in those years that I have been involved in this, Bobby Kennedy came in somewhere around 2005, maybe 2008, as a voice in this movement. He came in. He was not the first person to come in as a leader of this group, of this movement. He's looked at as kind of the person in this movement, and without a doubt, he is incredibly influential. And I am thankful to God that he involved himself in this, because his name, his stature, his intelligence, his ability to speak has been profound for health freedom movement. But he came in 2005, 2008. I started this process back in 1997 or 98, and there were people that started it long before I did. So this movement has been moving forward for a long time, and right up until COVID, things were getting ugly. Things were getting really ugly around the country when it came to vaccines. I'm going to save details for a later conversation, but suffice it to say that anxiety and anger, yes, lots of anger, had been building among myself and other people within the health freedom movement because of actions that were being taken. And Bobby was on the front lines. He was there. He was there helping and talking and giving support. And so, his involvement in this movement has been so important. And COVID was kind of the cherry on top of the whole situation, the proverbial cherry on top of the ice cream there, or the cake, because it was a culmination of what felt like incredibly invasive governmental overreach and incredibly deep layers of lies, just straight out lies by not only government agencies, but by every aspect of the legacy media. The lies were just pervasive, and they were so bold, so just bald-faced lies. And so leading up to Kennedy running for president and now hopefully becoming the head of the HHS, we finally see light at the end of a tunnel. We see hope for changes. And this is not just a matter of removing mandates from vaccines. That's actually a small piece of what we're hoping for. But it's the need for reconstruction of the government agencies that are involved in making decisions for your health and my health. That's paramount, and that's more than anything. And Bobby Kennedy has stated over and over and over again that he's not anti-vax. that moniker of anti-vax is given by the pro-vax, if you want to say that, to describe that end of it. It's given by those individuals to people like myself as a way to denigrate, as a way to put down and make us look like we're crazy or something. And that's the only reason they give that term anti-vax. It is a slur. And Bobby has said over and over again, many, 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 many times, that it's not a matter of being anti-vax. It's a matter of him wanting to be pro-science, but him wanting good, solid, quality science to back up the vaccine products. If those are going to be given out to children and adults, but the children are the focus, then these products need to be the best researched, the best studied products to ever be put onto the marketplace. And that's what he wants. And as the head of the HHS, he will be able to provide that finally, because regardless of what you hear from senators in the confirmation hearings, the research studies that show safety are flawed. They are highly flawed. Incredibly flawed. I mean, it's outrageous the amount of flaws within the research studies for vaccines. And that's the part that Bobby Kennedy is trying to change. He's not saying take away all vaccines. He's not saying you're not going to have the choice to get vaccinated if you want to. He's saying that if you choose to get a vaccine, it should be the safest thing possible. And he wants to ensure that. Now, with that in mind, who in their right mind would want to prevent that? And on top of that, his other goal is to help end the chronic disease epidemic in the United States, which is in no doubt an epidemic. We talked about that in a previous episode. So ending chronic disease in America, ending corporate capture and corporate control of the agencies that are supposed to be governing our health, providing the best quality, gold standard science that you can actually put into these products to make sure that they are safe for usage. Where's the argument? Where's the problem? So if any of you watched the confirmation hearings this past week, I watched quite a bit of it, but I had to stop. There was the first day of confirmations, and then there was the second day of confirmations, two different hearings with some difference in the people that were in the senators that were there. I watched a little bit of both of those. I had to stop. It was upsetting me so much. It was ruining every aspect of my day. It was affecting my interactions with my family and my patients in the office. It was affecting everything, because what was happening in these confirmations was it was a farce. It was a farce. You had senators who were just creating, they were like actors on a stage. This moral outrage that they were putting out there. I've watched, in my years on this planet, I've watched a lot of these different confirmations. I've never, ever seen the vitriol that was produced in these confirmations. The amount of sheer anger and hatred is what was being produced towards Bobby Kennedy was it was eye-opening. It was eye-opening. And so I'd like to go over a little bit of that today. That's a big part of what I want to do today. I want to cover some of this confirmation information to show you the lies that the senators were choosing to use, the slander that they were choosing to use against Bobby Kennedy. I think Bobby Kennedy held himself very well through the confirmations. He is a high quality individual. I've in the years that I've been following him in this movement, the multiple times that I've seen him in action, he's always cool-headed, always level-headed. He always knows the facts and knows what to present to people and presents it in a way that is digestible and easy to understand. And he doesn't get flustered. And my hat off to him for being able to handle that situation without getting flustered. He had maybe one or two exchanges where there was a little bit of heat from his side towards the senators because of the asinine things they were saying. But the sheer volume of lies that they were throwing in his direction and the ridiculous statements and questions. Do you support these onesies? Do you support these onesies? Bernie Sanders pointing at something that was sold from a company that Kennedy no longer involves themselves with and has nothing to do with what they're selling. Oh my God, he went off on that. He went crazy about the onesies. It was just it was hilarious. Megyn Kelly was sitting behind Robert Kennedy to his right, and you could see her cracking up. It was really funny. But it was ridiculous, just like that. They were having to really pull out of their bags of tricks something to try and trip him with and something to accuse him of, because he is such a clean individual. There's so much about him that's just so quality. If it had been me up there, guaranteed I wouldn't get confirmed, because I would have been, I would have been flipping them off, and I would have been telling them to go to hell for the things they were doing. But they weren't even letting him get a word in edgewise. So I wanted to address a few of the things that these senators were doing and the things that they were bringing up. Of course, the absolute number one thing, especially in the second day of confirmations, which was the health committee or whatever it was vaccines by far and away. And no matter how many times Kennedy told them, I'm not anti-vaccine, I am pro-good vaccines, I'm pro-science, I'm pro-good science, I'm not anti-vaccine. I do not want to take your vaccines away. I don't want to take away your choices for what you want to do. What I want is transparency, and I want science, good quality science. That's what I want. But even with that, these individuals could not get the red fog from their eyes and hear any of the things he's saying. Here's an interesting thing about vaccines. Excuse me. I don't know any product that is met with religious fervor at all. Vaccines are the only thing. Vaccines are looked at like a religion. They're looked at like a religion. If you think about it, there's so much brainwashing involved with vaccines. From the time that you and I were little kids and in elementary school and junior high school and high school and through college, the amount of brainwashing that we're given to make us feel and believe that vaccines are the saviors of mankind, that they can do no wrong, and that if anybody badmouths them, they must be totally crazy, therefore we should shun them. That's what people are taught. And if it's not taught in that verbiage, it's taught in that brainwashing that is in most people's heads, which is why I think most people react the way that they react when being confronted with information that goes against the narrative of pro-vaccine. When you go against the narrative of the vaccines with anything that questions them, the immediate reaction from people is, wait, what are you saying? You're saying something bad about vaccines? Don't do that. Don't do that. Don't say anything bad about vaccines. And it doesn't matter how much proof or information you give some of these people, they see the proof, the information, and then they gloss right over it and pull back the information that you may have already told was false and said, here, this is the proof. Well, wait a minute. What about the 10 things I just gave you here? No. Those are all ridiculous. This is the proof right here. Well, wait a minute. If you're showing me this proof here and I'm showing you all this proof over here, at least take a step back and say, maybe there's something I should look at. Maybe there's something I should look. Maybe I should pull back on my rhetoric. Maybe I should pull back on being so angry that someone's talking bad about vaccines. Maybe I should at least just look at this first. That's the hard part, is getting people to just do that all in and of itself. Those senators in both of those confirmations were glaring examples of exactly what I'm talking about. The amount of spit that was being produced from the conversation from the senator's side, every time they tried to ask a question about vaccines, it was like spitting angry words because Bobby has the audacity to question that industry, to question the science, to question the motivations behind it. Oh my God, how dare he question it? I mean, seriously, think about it just for a moment, how ridiculous it is for these senators to get as upset as they were over someone questioning vaccines. He didn't have some kind of bomb. He wasn't blowing up the building. He wasn't trying to kill people. He wasn't trying to take things away. He wasn't saying that he wanted to get in there and take all vaccines away. That's never been said. He's questioning the process. But he was being yelled at, screamed at by some of these senators because he has the audacity to do so. Amazing. Absolutely amazing. Okay. So I want to look at a few things that were said. Now, one of the senators, Republican, Senator Cassidy. Now, he's a Republican, and you kind of expected that all the Republicans were going to be supportive of Kennedy because, hey, Trump's their president, right? But no, that wasn't the case. Yes, by far, more Republicans were supportive than not. But this Senator Cassidy, I don't know where he's from. I know he's a Republican, but he came in right out of the gate with autism and vaccines. Autism and vaccines. Now, if I say that you can't speak ill of vaccines, you definitely can't put those two words together. Vaccines, autism. Oh my God. It's like you take magnets and you put the two ends together and they repulse each other. Vaccines and autism for these people is just this repulsive thing. You can't say that. But here's the thing. I don't know if these senators are just completely ignorant. Okay. Now remember, ignorance means that you just don't know. Okay. Stupid is you know and you do something anyway, right? Ignorant is you do it because you just didn't know. So let's just say that they're ignorant. All right, then good. I'm going to educate you right now. Okay. But here's the thing. These people are smart. They couldn't have gotten into their positions without having some intellect. And they've also got staff that can do things for them as well. Hey, go research this subject, bring back all the different points to me so I can look at it. No, instead, they repeated the exact same phrasing and words that have been repeated ad nauseum for so long now, for over a decade, regarding vaccines and autism. Vaccines don't cause autism. It's been proven. Well, no, senators, it has not been proven that vaccines don't cause autism. That is a ridiculous statement because the evidence is out there in abundance to show you that that statement is not a true statement. So I want to dissect that a little bit. I'm not wanting to do a deep dive into the subject right now. We will do that at some point, I promise you. But I want to show you how quickly and easily that statement can be slapped down. Okay. The statement of vaccines do not cause autism. And that was the point that Senator Cassidy was trying to capitalize on. Now, the point that was big for me is that he stated research, a meta-analysis. Okay. Now, and if you don't know what a meta-analysis is, a meta-analysis research paper is not a research paper that was done, just a singular study. What it is, it's the people who are doing the research paper going out and looking at all the different studies they could find regarding a particular subject, and then doing an analysis of all these different studies to come to a conclusion based on all of the different studies. That's a meta-analysis. I like meta-analysis in general as a research tool. I think it's actually really good because if it's done properly, then you can get really good quality science out of it, or proof of something out of it, because you're not just looking at one study that was done by one person. You're looking at, whatever, 100 studies, and then kind of compiling them down to say this is the meat of the matter. And the meta-analysis that Cassidy was bringing up is, and I do believe I do have it here. He brought up this meta-analysis. Now, this meta-analysis is the study, okay? The study that is brought up by anyone who ever talks about vaccines, okay? Anybody who ever makes that comment that vaccines don't cause autism, 9 times out of 10, what they're doing is they're citing this study, this meta-analysis. And so you would think that if all these important people are saying vaccines don't cause autism, this meta-analysis showed clearly that it doesn't cause autism. You would think that if they're going to say that, they would understand that they need to be able to back their words up with this meta-analysis. Not quite. All right, so I'm going to switch this screen over, and I want to show you the actual study. So this is the study here. It's on a PDF. Here, let me just get this out of the way here. There we go. All right. So as you can see, this study was done in 2013. It's vaccines are not associated with autism, an evidence-based meta-analysis of case control and cohort studies. Sounds really impressive. It sounds like, hey, that's it right there. It's in the title. We're done. And unfortunately, that's exactly what a lot of people do. They read the title of something and they say, okay, well, then that must be it. The other thing that people like to do is they like to read abstracts, and then they stop at that point and they don't go any further. And if you read the abstract, once again, it's going to sound pretty clear that, it's a done deal, that vaccines don't cause autism. So first, once again, let's look at the title. Vaccines are not associated with autism. Vaccines. Now, vaccines is plural, correct? And when you hear that word vaccines, do you get the idea that they're saying all vaccines? That's the idea that I get. I think that's the idea that they're supposed to be giving in that. And even in their first sentence of the abstract, it says there has been enormous debate regarding the possibility of a link between childhood vaccinations. That's a grouping again, once again, and the subsequent development of autism. Okay. So I'm going to point out just a couple of glaring problems with this paper. This paper has been dissected over and over again and brutalized because it's not a good paper. It's not well done. If you go into the methods for the creation of this study, you're going to find 2 big problems. Whoop, if I could stop jumping it around here. All right. So the first one, under statistical analysis, I want you to see what I've highlighted here. The analysis was to investigate risk of developing either autism alone or autism spectrum disorder alone after MMR, that's measles, mumps, rubella, okay? Mercury or thimerosal exposure. So what they were testing in this, okay, what they were looking at in this, the information they were looking at this was not vaccines. They looked at the MMR, which is essentially one specific vaccine. It's three viruses in one shot, okay, and thimerosal as a separate ingredient. So all they were looking at was the MMR and thimerosal as an ingredient. That's it. That's the first big problem with this. So with that alone, just that one little piece of the study being taken out and looked at with a more fine-tooth comb, it already shows the lie inherent in the statement that vaccines do not cause autism, and the science shows that. No, the science does not show that. The one big meta-analysis that they like to bring up all the time, that Senator Cassidy kind of hung his hat on, is not a study about vaccines. It is one particular vaccine, MMR, and one particular ingredient, thimerosal, and that's it. And that's it. Now, you might want to say, okay, well, at least they proved that that didn't cause autism. Well, once again, not so much. But the most important thing right off the bat is that this is the thing they hang their hat on, and it does not show that vaccines do not cause autism. Do you see that clearly there? The study was, this meta-analysis was not based on vaccines. It was based on one vaccine and one ingredient of the vaccines. Now, when you come down under the analysis where it shows the methods, this is just a flow chart, but notice that the part I highlighted here, potentially appropriate studies to be included in the meta-analysis. So remember, a meta-analysis takes a bunch of studies that have already been done out there that were singular studies, and then pulls them together to look at information. So they started from a base of 46 studies. I would not call that good. I wouldn't necessarily call it bad, but I wouldn't call it good either at the number 46. So let's just say that 46 was a decent number to pull from, okay? But then notice that the next two boxes here, it then says studies excluded for not meeting the inclusions criteria, 36. They ended up only doing a meta-analysis on 10 studies. 10 studies. This is junk science. This is junk science. They took 46 studies that they thought might have the information they want in it. And the information that they wanted, have no doubt at all, was to prove that vaccines did not cause autism. That's what they were trying to do. This wasn't a study to see, will they cause autism? Let's be open-minded and let's see that. It was a study that was set out to prove to those doubters that vaccines didn't cause autism. So first, we've got it not studying vaccines. It's studying one vaccine and one ingredient. The next thing we have is that they went from 46 possible meta research studies to only 10. That is not a good pool to go from. Now, I'm going to skip all the way down to the end of this study because there's something I also want to point out. Like I said, there's lots of information I could go over, but I want to just cover some really big points. The points I'm bringing up with this meta-analysis that Cassidy brought up should be more than sufficient to destroy his whole idea of this meta-analysis proves it. No, your meta-analysis does not prove it. Now, I highlighted 3 of those 10 studies, okay? So 10 studies were selected for this meta-analysis. I've selected 3 of them here, and I could have selected more, but I'm just trying to show you something here. The first one is here, and notice the very first name on this study, Verstraeten. Verstraeten is a big time vaccine research person in this industry, incredibly well respected, okay? He was the lead author on this one study. Now, here's the thing, and I'm going to come down here. I actually printed it out here. The lead author of this study, Thomas Verstraeten, in a 2004 letter to the editor of the Journal of Pediatrics, he actually admitted that his study was a neutral study, meaning that it could not rule out the relationship between thimerosal and autism. Let that sink in. the lead investigator, very well-respected investigator for one of the studies that they chose to put into this meta-analysis to say that vaccines don't cause autism, actually admitted on record that his study was not intended, nor could it rule out the relationship between thimerosal and autism. So now you're really down to 9 studies, okay, not 10, because one of those, the lead author is already telling you that it did not rule out that idea. It may not have said that it causes it, but it did not say that it didn't cause it either. All right. Now I highlighted 2 more here because I wanted to show you a name here. Thompson W. Thompson W. This Thompson W in these 2 studies is this same Dr. William Thompson who became a whistleblower against the vaccine industry. If you've ever heard of a movie called Vaxxed, there's been 3 movies called Vaxxed, Vaxxed 1, Vaxxed 2, Vaxxed 3. In the very first Vaxxed movie, the whole movie was centered around Dr. William Thompson's whistleblowing. And he came out as a whistleblower and stated that he was embarrassed and he was upset. He was felt guilty because they had destroyed research evidence to make the research look a certain way. And that was that there was no connection to autism. But he said with the actual data put back into the research that was taken out, it clearly showed that there was a connection with autism, and it was even stronger in Black male children, that Black male children had a much stronger incidence of autism with these vaccines, but that there was a clear evidence of autism with the vaccines. And this was the lead researcher, or one of the lead researchers for these studies, coming forward as a whistleblower to say that the papers were doctored. So you can see the frustration. Oh my God. When these people say these phrases, when ABC News and CBS and NBC and all the other legacy media repeat the tired diatribe that has been forced down people's throats for so long now, that vaccines do not cause autism. I showed in back, I think it was episode 2, I showed a clip. The clip was of a doctor, and I'm totally forgetting her name now, being deposed by Aaron Siri. Aaron Siri is a lawyer who goes after vaccine injury and things like that. And he was deposing this woman, and he had deposed another doctor. So there was these 2 doctors, male and female, who are the authors of a book on vaccines that is widely used in medical schools. And both of these doctors are big time vaccine researchers, been involved in lots and lots of vaccine research. And Aaron Siri deposed both of them. And in these depositions, so remember, in a deposition, you are sworn in under oath to tell the truth in front of this camera for the court. And in both of these depositions, both of these doctors were asked piece by piece, all of the different vaccines, okay, hepatitis B, MMR, DPT, whatever. He went through every single one of the vaccines with these 2 doctors and asked them specifically, does the research show that these vaccines do not cause autism? And both of them, for every single one of the vaccines, said, no, the research does not show that they do not cause autism, nor does it show that they cause autism, they wanted to bring up, okay? And so both of them basically said straight out, the information on these vaccines does not show either of those things. So here we go back again to this tired diatribe of vaccines don't cause autism that is repeated so often. Even the CDC says that vaccines do not cause autism. The head researchers are telling you that the research does not show that. Okay. So I'm going to get out of this real quick here. All right. And I want to pull up something else here. For those who are in the know, I have written a book on vaccines. It is called Vaccines Point by Point. 16 chapters, very heavily researched. It took me many, many years to wrap this up. The book is wrapped up. The book is ready to go. It is sitting, waiting to be through the process of publishing. And that feels like a really long road to get through publishing. I've been done for over a year with the book, and we're still just kind of going through channels. So hopefully this year will be the year that Vaccines Point by Point will be published and available. You will definitely hear it here first. And I hope you will purchase the book and read the book. But what I wanted to show you is actually from my book. From my book. Okay, this is point number 8 in the book. Point number 8 in the book is autism. Okay. Of course, I've got to have a chapter on autism. And so here is the chapter. So you are the first ones to see this. So point number 8, vaccines and autism. And so I'm just going to skip down here to this. So at this point in this chapter, I wanted to show the reader the research that's out there that shows links to autism. Okay. I'm not going to vouch for the perfection of every one of these research studies. I'm going to tell you that the research studies that the pro-vaccine people say shows this have lots of flaws in them and can be broken down and shown that they don't necessarily show what they think they show. And I am quite sure that the pro-vaccine side could take these and probably come up with some criticisms as well. And so, but if that's the case, if this camp can look at their research and clearly show flaws in their research, like I just did for the meta-analysis, and their side can show flaws in this, that doesn't necessarily mean we're on equal footing. Because here's the bottom line. If you have a toxic, potentially toxic substance that you wish to inject into my child, it is your responsibility to show without a doubt, without any doubt whatsoever, that it is perfectly safe before that sucker gets put into my child's arm, right? It's not mine. And so you can sit there and say, well, your study doesn't prove anything, so therefore we're back to square one and everything's okay. No, it's not the way that works. But I want to show you something here. So I'm not going to read through all these. It would take way too long to read through all these, but just to show you this first one here, serological association of measles virus and human herpes virus 6 with brain autoantibodies of autism. And this study is the first to report an association between virus serology and brain autoantibody and autism. It supports the hypothesis that a virus-induced autoimmune response may play a causal role in autism. And it goes on. So that's 1, 2, 3, and we go down, 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 and we go down. I have 34 citations here of research, 34. Okay. So when they say that there's no proof that vaccines cause autism, once again, not necessarily a true statement. If someone was being honest with you, then they would have to tell you that there is good, plausible cause or good, plausible reason to think that vaccines might have a role in autism, and therefore something has to be done. There should be some urgency, and there should be some more in-depth looking into these things. And that's not the case. This should be ongoing. But that meta-analysis, which was done in 2013, was doing a meta-analysis of whatever studies were done as a lump group. Okay, these studies came out really quickly in the early 2000s to try to say vaccines don't cause autism. And that's all they were trying to do, was prove that they don't cause autism, not to show any kind of reasoning why autism is happening and is there a link, just to show you that they're not. We just want to make sure that you know that they're not. And that's all those studies were doing. So that's 34 right there. And I know that that's not all of the studies that are out there. So I wanted to show that. And if we go down here, I have the information on William Thompson in this chapter, talking about being a whistleblower. He said the omitted data suggested that African-American males who received the MMR vaccine before the age of 36 months were at increased risk for autism. Decisions were made regarding which findings to report after the data was collected, and I believe that the final study protocol was not followed. That was from his sworn statement as a whistleblower, and that nothing ever happened with that. It was kind of shoved under the rugs. Senators looked at it back in 2014, 2015, looked at it briefly, and then nothing ever followed through with it. There are whistleblower laws that allow for a whistleblower to continue working at a company and not be harassed and not be fired. And so that's essentially what happened. It just all kind of got swept under the rug. So I think that was all I wanted to show you there. Now, one more thing here, and I'm going to get out of this first. One other thing I wanted to show you, and that was more than one of the senators pointed their fingers at RFK Jr. and said, "This is a yes or no question, sir. This is a yes or no question. Will you support that vaccines do not cause autism? Yes or no? Yes or no? Will you admit that the research proves that vaccines do not cause autism? Yes or no? Yes or no?" It's not a clear yes or no question. They know that. And all they were trying to do was put him on the spot and make him say something that he was going to regret. They also made statements about the safety of vaccines. Will you tell the American people right now that vaccines are safe and effective and blah, blah, blah? And they wanted to nail him down to say this yes or no thing. The problem is this. The real answer is no, Senator, these are not safe. But they weren't giving him time to even answer that properly to be effective like that. And so he had to find other ways to answer that because there was no way to answer it that was legitimate. The only legitimate answer, the only honest answer was, no, Senator, vaccines are not safe. They're not proven safe. The safety studies on vaccines are flawed in massive ways. Understand this real important point with vaccines. Vaccine manufacturers in 1986 were given carte blanche. The Vaccine Act of 1986 took all liability away from vaccine manufacturers, meaning that vaccine manufacturers, no matter how much they screwed up, could not get sued. Instead, they created a clown court made of government agencies that would take on any kind of liability away from the manufacturers and deal with it over here. They do a horrible job with it. It is a absolute circus and it's a farce. But the big thing is they took liability away from the manufacturers. Would you buy a car from a automotive manufacturer, from a car manufacturer? Would you buy a vehicle if you knew that the company making the vehicle had zero liability for the quality of the brakes or the safety restraint systems or the steering mechanisms or the fuel tank or any of those things? Would you buy a vehicle from a company that had zero liability for safety for the product that you're purchasing? I can't imagine anybody saying yes to that. The answer is an unequivocal, well, of course, no, I would not. I would not do that. But that's exactly what's happening with vaccines. You are basically saying, here's my child. I trust these companies with zero liability for the manufacture of these products, that they are going to be honest in their actions and that they are going to only have a product available for my child that is safe and effective and it's not going to hurt my child. They have no liability. Why would any company produce a product of quality without the liability? Because they're just good people and it's not about the money? Come on. We're all adults here. We should be able to know that is kind of a ridiculous thought process. The pharmaceutical companies, Merck and Pfizer and all the other ones, have a long, detailed history of lying to the public, being caught, and because they do have liability for those products, being sued. They have paid billions of dollars in lawsuits because they've lied about products. And those were products that they had liability on. With zero liability for vaccines, do you expect them to hold those to a higher standard suddenly? Oh, we lied about all these products over here and we paid, we're sorry, but we never lie about these products. They're totally safe and effective and it's okay. Really? I mean, come on. So I wanted to show you another little clip. This is Aaron Siri discussing the safety of vaccines.
Never gotten anybody's challenge or say anything in this document is false. With that said, you can, it's all cited to the government sources. Well, let's just zoom in on this one chart right here, okay? If you look at this chart, I'm going to zoom right in. These are the top 5 selling drugs that Pfizer has sold as of 2020, as of 2019, I believe, according to Money Inc. I'm assuming it's correct. And when you look at this list of the top 5 selling drugs, 4 of them are drugs. 1 of them is a vaccine. And what we're looking at is a summary of the clinical trial relied upon to license each of these products before they went to market. So when you look at Enbrel, it had a safety follow-up in its clinical trial before it went to market of 6.6 years against a placebo control group. Eliquis, Lipitor, Lyrica, multi-year placebo-controlled trials. Essentially what that means is you're comparing a group that got this product when it was experimental before it was licensed with a group that gets a placebo over a multi-year period, and then you're comparing, are there any neurological differences, immunological differences, cardiovascular issues? What is the difference in the safety profile between the placebo group and the vaccinated group? That's how you determine safety. And Pfizer wants to know that safety file before these products go to market because they don't want to end up upside down. But then look at the one vaccine on this list, Prevnar. 6 months of safety review, far less. A product given at 2, 4, and 6 months of age, by the way, and then at 12 months. Now, what was the control? It was a different vaccine, Prevnar 7. Now, you might say, hey, maybe Prevnar 7 was properly licensed in a long-term placebo-controlled trial, but that's not the case. It wasn't, and we'll go through that in a minute. But keep in mind, now I'll zoom out now, and we'll take a look now at the childhood vaccines. And these are the vaccines given in the first 6 months in the United States, 3 times each. And what you're looking at now is the safety follow-up period. That safety was reviewed after injection to these products.
So I'm going to stop it there, but you can see very clearly in this chart and know that this is not everything. This is just the stuff they put in the chart, but all of the vaccines, you can do this exact same setup here. Everything that's in the brownish color here, those are vaccines, and the blue, those are just these regular drugs. Notice that the regular drugs, the ones they have liability for, long-term studies. The Lyrica is only 2 years, maybe a little bit more than 2 years with that plus sign on there, which is not crazy long, like 7.4. But look at everything else: 6 months, 28 days, three days, really 3 days safety follow-up. That's what they used in the study. This information is taken from the safety study sheet information that is on the CDC website. This is not made up. This is not fantasy. This is from the research sheet, the insert sheet that you can find on the CDC's website. You can find this information. It's very easy to find. Placebos. A placebo is when you have a drug and you're comparing it with another group of people that are not taking the drug, they're taking a placebo. The the best placebos are going to be basically water, just saline. Okay, you're injecting water into this person, you're injecting the drug into this person. That's the absolute gold standard, because then you can say this person had absolutely nothing injected into them. These people had this injected into them. Was there a difference? And that's what you want to see. But look at all these vaccines: Hep B, IPV, Hib, DTaP, Prevnar, all of these, the controls that they used. Either there was no control group whatsoever, none, or look at what they were using for the control group. So here for Hib, the control group was another version of the same drug. They gave this version of the drug to this group, and then the drug that they're testing here, and said, I wonder if there's any difference. Well, you just put a toxic bag of crap into this kid and a toxic bag of crap into this kid, and now you're saying, what's the difference? Oh, there was no difference in the two of these, therefore this is safe. What's the insanity there? What is the freaking insanity there? The same thing with the DTaP, GSX. They put in DTP, which is basically just another version of the same thing, into the control group. That is what they're calling safety studies. And this is what your children are being subjected to. Do you see? Do you see? It is insanity. It is absolute flippant insanity. So when these senators have the audacity to sit there on their high horse up here, pointing down at RFK Jr. and saying, the safety is there, the science is settled. Oh, God, I hate that term. The science is settled. Here's the thing about science, folks. Science is meant to disprove itself. You don't have science and say, okay, we're done. That's it. It's settled. Smoking had science. Back in the days, smoking had science to back it up. Now, should we have just said, nope, no, 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 science is settled, okay? Tobacco companies did science and proved that it is safe and that it doesn't cause cancer. It's been proven. Oh, are you an anti-tobaccoist? Okay, you shouldn't be saying that, right? Can you imagine that? And that's the idea that these people are espousing when they say that the science is settled. It has been proven that vaccines do not cause autism. Number one, that statement is a false statement. But let's just say that, fine, I'll give you that. Let's say there was science that showed something, and that was done, 20 years ago, 13 years ago, whatever it was. Okay. Does that mean it's settled? No, it doesn't. Because if new science brings up another question regarding that, it has to be addressed. That's what science is for. So if your science showed, we really showed no linkage between thimerosal and autism, therefore vaccines are safe and do not cause autism. No, that's not what it means. It means that one ingredient, maybe, depending on the quality of those studies, isn't involved, but it doesn't mean that another ingredient's not involved. It doesn't mean that there's a reaction between two ingredients. Did they do a study that showed aluminum and thimerosal together and what that might do? Have they looked at aluminum by itself? No, they have not. We have, this group has, and it's showing links. And so to say that the science is settled and therefore shut your mouth, don't say anything, is infuriating. And it's very unscientific to state those types of things. Science is meant to rebut itself. It's meant to, you create a hypothesis, you show or you don't show. That doesn't mean that we're over. We can create another hypothesis to go against this one. And it continues and it challenges itself. Science should challenge itself. And that's how we get to real answers, is through that process. You don't get through that process by saying, it's been proven, so just let sleeping dogs lie and just shut up and go home. It doesn't work that way. So those attacks on Bobby were just that. That's all they were. They were just attacks. And if you saw that, I hope that you saw how vicious they were being and how it was just ridiculous. You had Bernie Sanders showing onesies for sale by Children's Health Defense Fund, which used to be run by Kennedy, but he has not been involved in that since he started campaigning for president. And so though the choices of having a onesie that has an anti-vaccine statement on it. Oh my God, Bernie Sanders went off the deep end on that. And Bernie Sanders, by the way, he wants to defend himself, saying that he doesn't take money from pharmaceutical companies. It's on the public record. You can see it. It's out there. So, just you shut up. You be quiet. And then you've got Elizabeth Warren. She started off, it seemed like she was going to be nice and cordial. She said, hey, get rid of chronic disease. I support that. Hey, get rid of corporate takeover and corruption. I support that. She kept going through this list of the things that Bobby has said, this is what he wants to do, and saying, that's a good idea. That's a good idea. That's a good idea. She went through 3 or 4 things and said, that's a good idea. However, and then she threw her curveball, and her curveball was, will you right now publicly say that you are not going to take any kind of money, kickbacks, or anything else from pharmaceutical companies during your tenure as head of HHS? And he said, of course I won't do that. I absolutely won't do that. But then she tried to stretch that, and she said, will you agree to not take any kind of money from lawsuits, because he has a law firm that does litigation against the pharmaceutical companies. If he had said yes to that, which wouldn't have been written in stone, but he would essentially have been agreeing to not take part in any of these lawsuits. That is, for all intents and purposes, is still tying his hands and saying you can't sue the manufacturers of these products. And of course he said no. Of course he said no. I'm not going to sit there and say I'm not going to sue these companies. These companies deserve to get sued. I'm going to sue them. And so she was setting him up. She knew what her questions were going to bring up. She knew that it was going to do this, and she did it. And so it was all very malicious. There was definitely malintent with all of these senators and the way that they were approaching things. The attacks hopefully have not done what the intent was, which was to stifle his nomination and not get him confirmed. This week, we will find out. I have a lot of nervous energy and anxiety this week still. When he has been confirmed, I will be able to breathe a deep sigh of relief and know that things can start to change for the better for our country. But until then, so that's kind of what I wanted to do there with Kennedy. I wanted to go through that information, and I wanted to show the ridiculousness of those attacks. Now, another piece to this is going to segue into the next part of what we're going to talk about today. I wanted to do a book review, and the book review is on The Real Anthony Fauci. This is a book written by RFK Jr., Children's Health Defense. That's the company that Bernie Sanders was going crazy on. Hey, if you got a baby out there, if you need clothes, go to Children's Health Defense and buy the onesies. I would love to see the sales for those onesies go through the roof because of Sanders' vitriol. That's a side note. But The Real Anthony Fauci, Bill Gates, Big Pharma, and the Global War on Democracy and Public Health. It's a decent-sized book, made even more so by the print. As you can tell, very small, closely set print. This book is not an easy read. It was, for me, a upsetting read. I knew most of the information that was in there already, or at least had an idea of most of the information that was in there already. But seeing the detail that was in the book was still upsetting. So I'm not going to sit here and tell you it's a fun book, but it is entertaining in the sense that it's incredibly informative. The amount of research and citations in this book is one of the things that's a bit overwhelming. If you, like me, when you read a book that is like this, like to look up the research as you go to verify statements that are being made, this book is difficult to do that because of the sheer number of citations. So, maybe if you just took, 1 out of every 10 citation, you could do a decent job of kind of, verifying sources in here. But if you tried to verify all the sources, this book is going to take you a long, long time because has got so many resources. I hate to say it, but when my book gets published, it's going to be similar to that. Each chapter has a whole bunch of citations. But Bobby is brilliant. He is one of the most informed people for this type of information that exists. And as a lawyer, he also knows, if I'm going to do this, if I'm going to make these statements against this person or this person, I need to make sure that this cannot come back to me. I need to make sure that they can't sue me for libel because I'm going to back up every single thing I'm going to say. And here's the thing. This book, let's see, it was published in, let me get the exact date of when it was published. It was published in 2021. So in 5 years out there, having sold millions of copies, he has not had one lawsuit for libel against him. Now, that in and of itself does not prove beyond a shadow of doubt that every single thing in here is true. But when you read this and you read the information that he states about Fauci, Tony Fauci, and when he talks about Bill Gates even in here, the fact that neither of those people have tried to sue him for libel to get this book removed from the sources is interesting. If this information is libelous, if it is false, which would make it libelous, why haven't they come after him? Why haven't they really said anything? I've seen one interview where Bill Gates was being interviewed by someone, I don't remember her name, where she mentions the book. And of course, Gates just says, it's fantasy. But that's it. The conversation kind of ends right there and nothing really goes any further. The information that's in here has been cited extensively. And so I think it would be very difficult for either of these gentlemen and gentlemen I use loosely, to make a case for libel. This book goes through a time frame that goes pretty far back and works its way forward through the pandemic. For most people, the vast majority of people, they only know Tony Fauci because of the pandemic. But he has been a fixture in America's health agencies for a long time. He has been likened to a mafioso godfather when it comes to those agencies because he's been there for so long and has so much power through those agencies that he has this control over so many people and influence. Fauci was one of the people that kind of got defended by some of the Democratic senators during the confirmations, that they wanted to defend COVID policy. They wanted to defend the COVID vaccine. One of the senators actually wanted to have Bobby answer a yes or no question, basically stating that the COVID vaccine was saved more lives than it killed and was this excellent thing. And the science doesn't support that. It doesn't support that. That's the interesting thing. You can make those statements all you want to, but just because you make the statement doesn't make the statement true. And so that was another one of the reasons why I wanted to start off with the confirmations and then segue into this book, because, this whole idea of holding up Anthony Fauci as a hero for what he did during the pandemic, and to hold up the vaccine as a savior, is another falsehood. There's way too much information out there to contradict that statement and say, I don't know if I would say that. So let's talk a little bit about the book. The book, like I said, is not an easy read. However, I do think it is a very important read. I think the information in this book is important for all Americans to read, especially if you're someone who felt that the pandemic was harmful and not the virus. I'm not talking about the virus, but the pandemic, the rules that were created during all of that. If you have any questions regarding the pandemic and about the choices that were made, this book I think is a must for you. It helps to back up a lot of that information. And so just kind of looking through the table of contents, chapter 1 is mismanaging a pandemic. And so Kennedy goes through step by step over 70 pages, these arbitrary decrees, okay, what he called science-free medicine. His next section is killing hydroxychloroquine. Next section is ivermectin. Then he goes into remdesivir, and then the final solutions, which is vaccines. He then goes through several other chapters that start to kind of go backwards. So he's kind of in current time with pandemic information. Then he goes backwards over Fauci's career to kind of show you how he got to this point and to show you his character and some information that may be a little nefarious or shady. For those who don't know, Fauci was very involved in the whole AIDS epidemic. During the late 80s, 90s, he was very involved with that. He was very involved with the creation and the distribution of AZT, which at the time was being touted as this savior for people with HIV. And he was very, very involved with Bill Gates and a lot of this with vaccines in Africa. And the information that is given in this book really paints a picture of a person who is far more concerned with his image and with the profits that can be made and not with the actual outcome of what occurs through his actions. AZT was, like I said, it was considered to be this savior for HIV, but it turned out that it really was not so much so. So in the book, like I said, it starts off with the pandemic. So there's a whole section where there's this talk about how Fauci just tried to discredit pharmaceutical agents like hydroxychloroquine and ivermectin, which were already in the system. They were very inexpensive. They had been around for decades and decades and been proven safe over and over and over again. So these two products, ivermectin and hydroxychloroquine, already had a history of research behind them for safety, and they were very, very cheap. He was part of the process that went about to discredit these inexpensive, safe pharmaceuticals in favor of ones that were really not proven to be safe. They had no real safety testing. Unsafe, ineffective treatments like remdesivir. Remdesivir was his drug. Fauci pushed that really hard. It was very expensive. There is a lot of information out there to show that it may have been far more harmful than it was helpful in the hospital situations. I'm trying to remember the nickname that the nurses gave it. Remdesivir. It's remdesivir. They said they nicknamed it "when death is near," because they knew that if someone came in and went through the whole protocol in the hospital with getting hooked up to a respirator and then given remdesivir, that their their ultimate fate was most likely going to be death. And so they re-nicknamed remdesivir when death is near. And Fauci's big thing was wanting ultimately the vaccines. The government manipulated studies, falsified data, all to justify their claims and their actions towards these means. So the plan was always the vaccines. The approval for the vaccines, because it was a, and now I'm forgetting the name of the approval. There's a name of approval that I'm forgetting right now. It'll probably pop into my head, but anyway, this approval that they were given here, which was kind of a pandemic type approval mandate, could only be given if there were no other options. So to fast track these vaccines, to push them through very quickly and then get them into the public with no liability, the only way for them to be able to do that is to show that there were no other options available. So when ivermectin and hydroxychloroquine, when those were shown and were being talked about as these effective possible treatments, those had to be shut down, and they had to be shut down quickly and hard, because if they were shown to do anything, then the approval process for these new vaccines would have been halted. And that's just a reality there. In his book, he shows numerous, and I mean numerous, examples of what he would refer to as regulatory capture, the stuff that he talks about wanting to change through HHS. He talks about Fauci's, like I said, his experiences in kind of the parallels between AIDS response with Fauci and COVID, and how Fauci managed or mismanaged the AIDS crisis, and how there's a lot of parallels with how he ran COVID. And he does a good job of showing that. He talks about a documentary which I had never heard of and I have not seen. It's on my list now to watch. It was in 2004. It was called Guinea Pig Kids, a documentary, which explains in detail Big Pharma's stampede to develop lucrative AIDS remedies and Fauci's involvement in that, his support and guidance, which led to these horrific abuses of countless individuals. And that's the documentary that states all this, and that's mentioned in the book. In the 1980s, supposedly, from the book, I'm just quoting from the book here, Anthony Fauci would not allow doctors to consider any other drugs other than AZT to treat HIV and AIDS. Does that sound familiar? It sounds very familiar, because once again, this was exactly what he did during COVID when it came to ivermectin and it came to hydroxychloroquine and anything else that was brought up that was natural. And AZT killed thousands of people. The FDA actually at one point deemed AZT too toxic for human use. And many researchers argued that AZT killed more people than actual AIDS did. And once again, remdesivir, very identical in the strategies and very identical in the outcomes when it comes to what we see with his actions with AZT and the final product, and his actions with ivermectin, et cetera, and remdesivir and the final product. Very, very similar. NIAID, National Institute of Allergy and Infectious Disease, which was Fauci's agency, and his big pharma partners, and I'm going to quote this. I got it right here. This is straight from the book. It says, Fauci's NIAID and his big pharma partners turned Black and Hispanic foster kids into lab rats, subjecting them to torture and abuse in a grim parade of unsupervised drug and vaccine studies. This is kind of the idea, this image that is created in this book regarding Fauci especially. And then when he ties Gates together with that, it's interesting because I wrote my chapter on COVID in my book before I ever read this book. I had not even touched this book before I started writing my chapter. And the conclusions are, there's a lot of similarities in a lot of the conclusions that we came up with. And I had no understanding of this book at all when I started reading that. The idea of Fauci meeting with Gates to have this agreement to vaccinate the entire population is something that is talked about in the book. And he mentions that the personal worth of Gates, in fact, I've got another quote here on 291. Moreover, Gates' personal net worth grew from 63 billion in 2000 to 133.6 billion today, from 63 billion to 133.6 billion. Gates' wealth expanded by 23 billion just during the 2020 lockdowns that he and Dr. Fauci played key roles in orchestrating. So this idea of profiting from this, ginormous profits, and most of those profits came from the vaccines. And Gates was on TV saying the vaccines are safe, effective, that you can't catch COVID from these vaccines. And then when the science started showing that there was a problem with that, Gates got out of the vaccines totally. He cashed in, making these huge profits. And then when he was questioned again, stated, there are these problems with the vaccines. He switched his story totally, but he didn't do that until after he cashed out. So there's a lot of interesting information in this book that really makes you look at Fauci and look at Gates in a really interesting way. I wanted to show you a video here, a couple of videos, to kind of illustrate once again this two-faced monster that Fauci really is. So here's the first video. Let's bring this up nice.
Do know that if you look at a vaccinated person and compare him to an unvaccinated person, the incidence of asymptomatic infection is much lower in the vaccinated person. So not only does it prevent you from getting clinically recognizable disease, it prevents you to a great degree from getting subclinical asymptomatic disease. Point number one. Point number two, even when you do have a breakthrough infection, namely you're vaccinated, you get infected but you don't have any symptoms, the level of virus that's in your nasopharynx is remarkably lower than a person who is not vaccinated and gets an asymptomatic infection. But every bit of data that we're accumulating right now strongly suggests that it's going to be very difficult to transmit the infection if you've been vaccinated. We know now from follow-up studies that the Pfizer and the Moderna product, that the protection lasts at least 6 months, likely 8 months and longer. But we don't know how much longer because we've only been doing this for less than a year. So I would hope it's going to be longer than a year, maybe 2 or 3. But if it isn't, then we have to leave on the table the possibility that we might have to come back and give people boosters intermittent.
So that's the first piece, okay? And where he goes on about how wonderful these vaccines are, okay? How wonderful these are. That video, by the way, was done in 2021. That was an interview in 2021, okay? So now compare that with this next video.
I got infected about 2 weeks ago. It was my third infection, and I have been vaccinated and boosted a total of 6 times.
What is that? 6 times. 6 times. He caught COVID 3 times. 3 times, and he was vaccinated and boosted a total of 6 times. So this idea that the COVID vaccines were effective, they were showing that they weren't effective from almost out of the gate. If you go back and start looking at the research information on COVID vaccines, they were showing very poor results from the word go. And when it comes to the safety of these vaccines, once again, that's an insanity. So I want to show you one more thing here, which is kind of, once again, going to go against all of this information that is pro Fauci that the senators were trying to put out there. So let me pull this one up here. This is also from my book. This is the last chapter in the book, chapter 16, which is the SARS-CoV-2 agenda. Let me pull this one up here. You're getting all these previews of my book today. So here we go. So I'm going to scroll down. This is, like I said, this is chapter 16 here. And this is going through the pandemic and the information, all the stuff that they said. And, you know, like I said, I did my own research. So the first two conspiracy ideas that people thought were, you know, that this is a virus of the elderly and infirmed, and that deaths are inflated numbers. So that if you said these things, if you said that this was a virus of the elderly and infirmed, people said you're a conspiracy nut. That's bull. If you said that the numbers of deaths were inflated, once again, you're a conspiracy nut. That's bull. And I go through here and I actually show how the research and the information proved after the fact, even during the fact, that those were correct statements, not conspiracy. Then I go on to talk about masks are not an effective protection for SARS-CoV-2. Once again, if you said that, you're a nut job for saying that masks weren't effective and that the 6 feet distancing is a joke. But of course, once again, the research really showed that. It actually showed that. Then I went on to talk about SARS-CoV-2 was released from a lab in China. Oh my God, if you were to say that, man, you would lose all your friends because they would think that you were a total nut job, right? And then we talked about alternative treatments are not effective and safe. Ivermectin, hydroxychloroquine, of course they were. 7, anything said even remotely that went against the vaccines, you're a conspiracy nut. So that is where my chapter ends. But I then placed an addendum to the chapter, because on December 2nd of 2024, just here recently, the Select Subcommittee on the Coronavirus Pandemic released its final report after 2 years of investigation. This was a subcommittee that was made up of almost perfectly equal Democrats and Republicans who did an investigation jointly, did tons of interviews with people, and then came to conclusions based on their investigations. This was, now the full report was over 500 pages. So I didn't certainly put that here, but what I did is in bold, I put their findings. And so think about the things that people were considered nut jobs for saying. Think about all the people that were held up to high standards, and then look at their conclusions here. So SARS-CoV-2, the virus that caused COVID-19, likely emerged because of a laboratory or research-related accident. Their findings after 2 years are that the most likely result, the most likely cause, was a lab situation. Hey, there you go. The proximal origin of SARS-CoV-2 was prompted by Dr. Anthony Fauci to disprove the lab leak theory. So what they're saying there is that basically Anthony Fauci lied, that he prompted this proximal origin idea strictly to disprove the lab leak theory. That was it. It wasn't because it was actually a real thing. He was trying to get it disproved. So they're saying that Anthony Fauci lied, is what they're saying there. There was no quantitative scientific support for the 6 feet of social distancing. Go figure. Masks and mask mandates were ineffective at controlling the spread of COVID. Public health officials flip-flopping on the efficacy and use of face masks without full scientific transparency caused mistrust in public establishments. Fauci himself did that. The Biden administration exceeded its authority by mandating masks. The U.S. Center for Disease Control and Prevention relied on flawed studies to support the insurance of mask mandates. Once again, they lied. Forcibly masking young children ages 2 and older caused more harm than good. Amen to that. Lots of damage caused to children with those masks. And if you're a parent out there right now still having your child wear a mask, you need to open up and look at the studies and look at the information, because you are harming your child with those masks. The masks are not helping prevent anything for these kids, and their risks of serious involvement, even if they do catch COVID, is minuscule. But the amount of damage you're doing psychologically and health-wise with those masks is huge. Enduring COVID-19 lockdowns unnecessarily harmed the U.S. economy. Remember, this was Republicans and Democrats that did this research and came up with this, right? Enduring COVID-19 lockdowns unnecessarily damaged Americans' mental health, disrupted the development of American children and young adults, had severe consequences for America's physical health. Officials incorrectly characterized the lab leak theory as conspiracy. The Biden administration employed undemocratic and likely unconstitutional methods to fight what it deemed to be misinformation. Just go back to, what's his name? Facebook. Totally dropping the guy's name. But go back to the guy who runs Facebook, who just came out and said, "Oh, I'm so sorry." Well, actually, no, he didn't say "I'm so sorry," but he said that the Biden administration coerced Facebook into Zuckerberg, shutting people down for misinformation, and it was all false. Biden administration and many public health officials exaggerated the power of the COVID vaccines. The U.S. Food and Drug Administration and other public health officials falsely implied that ivermectin was only for horses and cows. The Biden administration sidelined senior scientists after they expressed concern regarding the rapid pace of Pfizer's biologics approval applications. So, once again, scientists who had ethics stepped forward and said, there's something wrong with this, and they got punished for it. Herd immunity is a real concept and occurrence supported by public health leaders such as Fauci, that natural immunity. Fauci came out and said that natural immunity was not as good as the vaccines. Total falsehood. Natural immunity is always better and always has been better. COVID-19 vaccine mandates caused massive collateral damage and were very likely counterproductive. COVID vaccine mandates were not supported by science. Don't have to listen to me. You can listen to this. COVID-19 vaccine mandates hampered U.S. military readiness. Vaccine adverse event reporting system is insufficient and not transparent. I mean, it goes on and 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 on. And I don't think I put it in here. I did not put it in here. It was one of the ones I didn't put in here. This was not all of their, this was not everything. Like I said, it was 500 pages. One of the points that was brought up in this report was that Fauci lied, that Fauci got on under oath and lied about the existence of the lab leak and many other aspects, that he lied in front of Congress. But of course, now he's pardoned and we can't do anything about that, supposedly. So Biden pardoned him from 2014 to now. Very interesting why he went all the way back to 2014 to pardon him. But with that pardon, he may be protected from lying to Congress. So Fauci's not a great guy. He's not a great guy. This book is an excellent read if you want to really educate yourself on the information regarding COVID and the pandemic and all of the stuff that happened during that time period, and really put a nail into the coffin of the whole idea of conspiracy theory. This is an excellent read. Once again, the challenges are that it's technical in a lot of places. It is a long read because it's very thin, closely set type, and there's lots and lots and lots of research that if you want to look at it, it's going to take you some time to do so. But still, all in all, an excellent read. Next one I'm going to review for you guys is the Pfizer papers. I'm not quite done looking through that. Most of what's in there is stuff that I already feel like I knew anyway, but I want to make sure I've gone through the whole thing before I get on here and start talking about it. But the Pfizer papers are going to come up next. So let's wrap it up here. I'm going to hope that Kennedy gets into that position, because it's going to make the biggest change in America's health that we've ever seen. And hopefully everybody out there is getting good juju out there for him. I hope you learned some stuff today, as usual. I hope you found it interesting. And I hope it leads to you investigating other information and getting a little bit deeper into this stuff. The whole idea of vaccines is a topic we're going to talk a lot about, because it is one of these areas where the government has been lying for so long, and it's so pervasive that the brainwashing has just affected so many people. So we will talk about that more. So until next time, good health. Bye.